Yeah, good morning, everyone. I'm Will Lorenz, second-year general surgery resident at Atrium Health. I have no disclosures. Neither do any of the authors on the study. So emergency general surgery comprises 3 to 4 million, or 10% of all annual hospitalizations. The EGS population is vulnerable. An improvement in hospital and process factors are necessary to improve outcomes. Emergency department overcrowding has become routine, paralleling the rise of the EGS population, the impact of COVID-19, and a growing urban residents. Freestanding emergency departments offer a safety net for overburdened medical centers and their emergency departments, but lack on-site surgical providers, and therefore surgical consults have to be virtually triaged. Additionally, the transfer of this patient population has been associated with increased morbidity and mortality. The aim of our study was to evaluate the safety of freestanding emergency department virtual triage in the EGS patient population in comparison to in-person evaluation of the EGS patient population at a community hospital. This was a retrospective cohort study conducted at an Atrium Health community hospital between January 2016 and December of 2021. Our two cohorts were adult virtually triaged EGS transfer admissions from a freestanding emergency department to our community hospital, and all adult EGS admissions after in-person surgical consultation at our community hospital. Our results, so of 1,962 patients, 631 were transferred and admitted to the community hospital after presenting to a freestanding ED. 1,331 patients were admitted to the community hospital after presenting to the community hospital ED. There was a higher percentage of patients in the freestanding ED group who were Caucasian, had commercial insurance, as well as a lower CCI score, compared to the patients who presented to the community hospital who had a higher percentage of African American race or Hispanic ethnicity, who had Medicaid or who were self-pay. The most common diagnoses from freestanding ED cohort, including appendicitis, small bowel obstruction, and diverticulitis, whereas incarcerated hernias were more common at the community hospital. The community hospital cohort was significantly more likely to undergo surgery during the index visit, whereas the virtually triaged group was more likely to undergo laparoscopic surgery and had shorter operative times. So our unadjusted outcomes demonstrated significantly more 30-day acute care visits, which were counted as visiting the ED, being admitted to an observation or inpatient status in the group that presented to the community hospital. There was no evidence to show statistically significant differences in 30-day readmission, 30-day mortality, or length of stay based on univariate analysis. After propensity-score matching and multivariable analysis, identified no significant difference between all cohorts in outcomes, including 30-day readmission, 30-day mortality, and length of stay. Our limitations of the study were really generalizability. So this study looked at a freestanding emergency department within the Atrium Health system, which is a large hospital system with 24/7 access to any specialists you could need. And this isn't the case with freestanding emergency departments across the country. Outcome improvement for the EGS population must focus on process improvement. Freestanding EDs are a viable and safe option for the EGS patient seeking care in our overburdened healthcare system, but overall there is limited standardization among freestanding EDs. Successful virtual triage requires seamless communication between providers, easy access to patient data via the EMR, and a supportive hospital structure. There's growing efforts in the standardization of the EGS patient care, but more work needs to be done to optimize the care of this vulnerable patient population. And finally, transferring the EGS patient population has been associated with increased morbidity and mortality, but we found no increased risks of 30-day readmission, mortality, or length of stay in our study. So in conclusion, patients who undergo virtual triage have similar outcomes to those who undergo in-person triage for EGS diagnoses. Virtual triage at freestanding ED for these EGS patients may be efficient and safe means for initial evaluation. Thank you.